Good morning. Welcome everyone. Welcome to another Sunday session by Samanway Trust. Before we begin, I would just like to remind everyone that this will also be a two-part session. So I request you to join part 2 using the same link. Moving forward with today's session, we have with us Dr. Karishma Jethmalani, who will be presenting the topic stress management among COVID patients. Dr. Jethmalani is a psychology and neuroscience graduate working in the rehabilitation field since 5 years. She is currently working as a neuropsychologist in Sir H.N Reliance Foundation Hospital in Mumbai, where a lot of her work involves neuropsychological testing and cognitive rehabilitation in neurodegenerative disorders and acquired brain injury. In addition, Dr. Jethmalani also runs a memory school at the hospital for people in early stages of dementia and various other group interventions. With that, I request Dr. Jethmalani to kindly take over. Thank you.
Yeah. Thanks for the introduction. It's a pleasure to be here. I would like to introduce myself. My name is Karishma, and I'm a neuropsychologist working in Sir H.N Reliance Foundation Hospital. And the main purpose of this session today is to give a talk on how to effectively deal with stress and anxiety during these very, very difficult time. I'm just going to share my screen because I would like to share my PPT. So just give me a second. Sorry. Share my screen. Okay. All right. Are you all able to see the screen?
Yes.
Are you able to see the screen?
Yes, ma'am.
Yes, we
Yes.
can.
Okay. Perfect. Perfect. Thank you. So just to introduce, like I said, we are currently experiencing a second wave of the COVID-19 pandemic. It is naturally a very, very difficult situation and can be very difficult to contend with, especially when we felt that things were finally getting close to normalcy and things were getting better. We have absolutely no clarity on when the virus will disappear. And this can often lead to feelings of uncertainty and anxiety and raises question like if the new normal is now going to be the normal. And this sort of prolonged uncertainty can sometimes lead to something called a pandemic fatigue. Now, since the start of the COVID-19 pandemic, pretty much in March 2020, I have dealt with thousands of COVID-19 cases admitted in Seven Hills Hospital, which is also sort of run by Sir H.N Reliance Foundation Hospital, and patients who are home quarantined, and just generally dealing with people with general pandemic-related anxiety. And while I was seeing these people, I compiled a list of common stressors that cause such mood-related disturbances. So first, let's try to explore what are the main causes of this sort of prolonged anxiety during COVID-19. Okay. So in these calls and talking to these people, I have observed that some of the main causes of such mood disturbances during the pandemic are A, financial crisis. A lot of people have lost their jobs. A lot of people have got salary cuts. Second is the lockdown itself. The lockdown being prolonged for such a long time, this thing coming to no end. And now, people talking about the third wave can certainly cause a lot of anxiety. Third being death of loved ones. I've seen a lot of my own close people who have lost a family member in their house, and it's extremely sad. The fourth one is distancing and quarantine. We are not used to being socially distant since we are social animals, so that can cause a lot of distress as well. And media, news, and government exposure. A lot of these WhatsApp forwards, forwarding bogus messages, from people who are not trained to give advice. So these are some of the main factors causing a lot of stress and anxiety during this current pandemic. And let's try to see now the psychological impact of these stressors on people. So these stressors have caused feelings of very common feelings of irritability, fear of contracting COVID, spreading infection to family members, anger, confusion, frustration, insomnia, uncertainty, loneliness, anxiety, and in worst case scenarios, suicidal ideation as well. Now, to illustrate this, let me take you to a case study involving Dr. DB. Now, Dr. DB is somebody I work with inside H.N Reliance Foundation Hospital. And while he contracted COVID, I was sort of seeing him, I was counseling him around that time. So let's try to go through his case study. So Dr. DB is a 32-year-old junior resident from Bangalore and is currently working and living in Bombay. Now, Dr. DB's wife recently delivered a baby girl. He worked really hard in the first wave, and he was very excited to finally, go and see his wife, his elderly parents, and his newborn baby. Dr. DB has been working really hard over the past 1 year, often doing 36-hour shifts, working in the ICU, working in ER, and he was really, really, really looking forward to taking a break and visiting his family. So he booked his tickets 3 months in advance. Now, as a pre-requirement for air travel, Dr. DB had to undergo a mandatory COVID test. As he was preparing to leave, he got a disappointing news that he was COVID positive. After hearing the news, Dr. DB was naturally very upset and disheartened. He was then asked to be quarantined for the next 14 days in his accommodation, which could extend even beyond that, depending on his test results. Now, Dr. DB reported feeling very stuck, very confused, not knowing what to do in this situation. He is worried that he won't be able to see his family for another few months. He doesn't know how long the pandemic is going to last for, or when he's going to be able to resume his duty as a doctor. Dr. DB reports feeling very unworthy, blames himself for all this, and he feels he's not doing much and isn't contributing to anything. He further reports feeling really bored and lonely as he is living alone and doesn't know how to pass his quarantine time. So he continuously watches WhatsApp forwards and keeps checking COVID news on the internet, which gets him even more distress. Now, can somebody tell me what emotions might Dr. DB be experiencing here? Let's try to make this a little more interactive. Anyone? Okay, not a problem. Let's explore what emotions Dr. DB was experiencing in this scenario. The first one was sadness. Sadness about not being able to see his family, naturally, since he was so eagerly looking forward to seeing them. Second is feelings of uncertainty, of feeling of not knowing how long does he need to stay home, of not knowing whether he's going to be able to see his family or not. And when will he be able to resume his duty as a clinician again? And the third emotion would be boredom. Boredom about being locked in the room, not having much to do, not having anyone to talk to. Fourth would be feelings of guilt guilt about not being able to perform his role as a husband, as a father, and as a doctor. Now, what Dr. DB is experiencing here is a perfectly normal reaction to this situation. It is perfectly natural to feel this way, to feel how he's feeling. The key isn't to get rid of negative emotions. The key is to use them well. In fact, the point of all our emotions is to use them well, is to use them to our advantage. Anxiety can keep us alert. Sadness can remind us of what is important to us. Anger can help us to fight injustice. So it's all about learning how to use these emotions well, to use these emotions to your advantage. And while it is important to accept and acknowledge your feeling, but dwelling on it endlessly can have a very detrimental effect on your mental health. It's okay to acknowledge, it is very healthy to be aware of what you're feeling. But the problem happens when you dwell too much on it, when that thought, when that emotion takes up a lot of your time. That's when the real problem starts. So while we can't push away or get rid of negative feelings, we can learn to cope with them better. So let's try to explore how to cope with these stressors more effectively during this very difficult time. And let's see how Dr. DB was able to cope with these emotions as well. So the first one, my first tip would be to focus on what you can control. Now, something that is really important in resiliency is feeling like you have control or agency in your life. We all need some amount of control in our lives to feel secure. And this is something that has been torn away from us during this time. There is a lot of uncertainty around. We are not in control of the situation. Feelings like, how long is this going to last for? What if I get sick? This sort of uncertainty brings about a lot of distress. Now, we may not have control over the external factors or the virus, and there's very little that we can do about it. But there are a lot of other things that we can do, which is within our sphere of control. Our attitude towards the virus, our thoughts, what actions we take are all in our control. Hence, it is very important to find what's within your sphere of control and focus all your energy into that. So whenever you feel overwhelmed, try asking yourself, what can I do about this? Try to look for solutions and accept the things that are beyond our control. For example, if you're scared of getting infected with COVID, focus all your attention on sanitizing your space, eating healthy, exercising to boost your immunity, and finding other things that you can do that is within your control. Now, another way of gaining some control in your life is by creating a routine. Now, a routine or a timetable isn't just for kids, but it is a very well-established prescription for people experiencing anxiety and distress. Once the world becomes very unpredictable, once the world becomes very uncertain, you have to create a predictable world for yourself. And setting a routine does just that. Now, obviously, a lot of the root cause of anxiety is basically fear of unknown. So it becomes very important, especially during this time, to make your schedule very predictable. So you know what is coming next. You may not have external control over things, over the situation, but at least you have some internal control into your own life, which is a cheat sheet of getting some predictability into your life. And while you're creating a routine for yourself, it doesn't have to be very stringent or very complex. A routine can be very basic. It could be something as simple as picking 5 important areas of your life. One could be your work. Second could be a physical activity. Third could be a social activity. Fourth could be a recreational activity. And fifth could be a spiritual activity. So these are generally 5 important areas in everyone's life. So try giving some time to those 5 areas. When you're making a schedule, try asking yourself, how much time should I give each area of my life? For example, have a set time to wake up, scheduling 3 hours for work or learning a new skill if you're not working, 1 hour for exercise or self-care, 3-4 hours to socialize over video calls, some time to playing games, reading books, some recreational activity. Maybe if you're a spiritual person, making some time to doing some chanting or doing your prayers, right? So set times for each area of your life and follow them religiously. This will make you feel that you're contributing to something. Now, obviously, Dr. DB, since he was sitting idle at home, he was not doing anything. So he felt that he's not doing anything with his life, and that was causing him even more distress. So very important to stick to a routine and make a predictable schedule for yourself so that you look forward to things, so that you feel that you're contributing to important areas of your life. So this could be, I just gave an example of a weekly activity schedule, like a template that you could use. Moving forward, now I see a lot of people running very low on motivation. And this is one of the commonest questions that have been asked, that how to, because a lot of people that are working from home have absolutely no motivation to work. They don't really, they are missing that looking forward to component since everything is shut in Bombay. And because of that, your motivation can sometimes go a little low. And it's only very natural to feel this way with everything going on and things getting extended for such a long time. So if you feel that you're running very low on motivation, it really helps to try breaking tasks into smaller subtasks. Try to make checklists for yourselves. Make sure you have all the resources ready to complete your tasks. Meeting goals will give you a sense of achievement, which in turn will improve your motivation to do more. Remember that action leads to motivation and not the other way around. You don't get motivated to perform an action. Once you perform an action, you get motivated, right? And some people may say that I'm still feeling more demotivated, even despite, making these checklists, making, these subtasks and etc. So if you're still feeling demotivated, hello, sorry. Okay, I'm going to continue. So if you're still feeling demotivated, take your schedule as a 9 to 5 job. Even if you're not motivated, do the task for the sake of doing it, and motivation will automatically follow. Some days, taking my own self as an example, some days I don't feel like exercising. I know exercising is very important for my health, but I don't feel like exercising. So I tell myself that I'm going to exercise for 2 minutes. And if I don't feel like exercising after 2 minutes, I will stop. But then I find myself exercising till the next 40 minutes and time just passes by. So remember, just to reiterate, that action leads to motivation and not the other way around. All you need is to just get started sometime and follow the 2-minute rule. Another thing that always helps is to plan and arrange everything in advance. For example, if you want to work in the morning, try opening up everything in your computer you need to work on a night before. Or if you exercise in the morning, it helps putting your exercise clothes next to your bed. This will really help you get things done. Moving on, my next tip would be to socialize, to connect with other people. Now, like I said before as well, we are social animals. Socializing is very, very important for our survival. Lack of social connect can lead to loneliness and increased distress. So remember to reach out to people when you're going through a tough time. The most effective thing that you can do to feel better is talk to someone. Talk to somebody through your problems. Even telling them how you're feeling will increase awareness into your problems. Like they say, right? There's a Hindi saying that लोगों से बात करने से मन हल्का हो जाता है, right? That is very true. Why does that happen? Because when you're talking to people, you're sharing what you feel with them, right? You get that sense of awareness into what is exactly bothering you. And awareness is the first step to solving any problem. So connect with somebody, talk to them, connect with somebody you're comfortable talking to. That's very important as well. And share with them how you feel, or hear somebody out, help somebody out through their problems. As helping somebody out could also make you feel better, it will make you feel that you're contributing to something, you're doing something meaningful with your life. So schedule phone calls, make a list of 5 friends or relatives you're comfortable talking to, schedule virtual meals with your close friends. You can schedule virtual dates as well with your loved ones. And there are a lot of apps recently that are made during the lockdown that can help you play games with your friends online. So try doing that. So let's move to the next section. Right. So my next tip would be to limit how often you check the news. Now, after this, we're just going to take a short break. So continuing, like I said, my next step would be to limit how often you check the news. Now, while being informed and updated about the current affairs is very important, checking the news obsessively, especially around this time, can cause a lot of distress. If you're constantly exposing yourself to something negative, you will feel negative. You are inviting negativity into your life. So every time you feel the need to check the news, divert your mind to something very productive and very happy. There are a lot of good things. There are bad things happening around the world. I agree. But there are also a lot of good things happening around as well. Now, whenever I open my Facebook, while I see a lot of depressing news, I also see a lot of nice people, helping people out, distributing food to people who are in need, right? A lot of these NGOs doing very good work, right? So focus your attention on that instead of ruminating over the negative things that are happening around the world. I personally feel that we are in a much better place than we were a few years ago. If this happened a few years ago, I don't think we would have been able to make things work as we are currently, because we didn't have technology back then. And now a lot of things can be done online. So certainly the world is getting better. I also feel that the vaccines are working. I've seen people, even in their 90s, with several comorbidities having mild symptoms after taking even the first dose of vaccine. While the vaccines can't prevent COVID, but it can certainly reduce the severity of the virus. So before moving to the next section, we are going to take a little break so that you can sort of, refresh your mind a little bit as well. So let's take a break and let's continue after a bit. Thank you.
Thank you, ma'am. Hello. So yeah, we are taking a break right now and we'll meet on the other side. I would just like to remind everyone that you can use the same link that you used to join this session. And we'll see you on the other side. Thank you.